The coronavirus pandemic spreading across the country now, further disrupting daily life. Nearly 3,000 cases now reported in 49 states and Washington, D.C. A total of 57 deaths, with the majority in hard-hit Washington state. This is the House overwhelmingly passed bipartisan emergency legislation to fight this pandemic. After getting President Trump's backing, it goes now to the Senate. My first guest says we can overcome this. House Minority Leader Kevin McCarthy of California. Congressman, it's good to see you this morning. Thanks very much for joining us.
Thanks for having me back, Maria.
Tell me about the bill that really went so late on Friday night, what it has in it, why is it important?
Well, we went late because the original bill that Speaker Pelosi put was just not workable. And as I said on Thursday, we should take a deep breath, not leave Congress, take the next 24 and 48 hours and fix it and actually come together. Take the parts that divide us and let's unite for the American public. What it does is three main things. It makes sure everybody has the ability to get a test if they need it. It allows for sick leave if you are sick or if you're caring for a loved one. It makes sure the VA and the Department of Defense has the resources needed to care for those veterans. I had a real concern when what it did to small business. That were some real changes inside the bill, and that's why it came late. I wanted flexibility for those small businesses, especially under 50. We have to make sure if you're going to mandate small business to provide this leave, how can they have the resources? The Speaker had Social Security doing it, would harm Social Security, and they couldn't get it up and running. The Secretary of Treasury will now advance the money to small business for that quarter to pay for that sick leave going forward for this short time period, making sure that we have a timetable on this, that there is a sunset, and also Democrats had put in a number of provisions that were just philosophically wrong with anything to do here. They wanted to change the law and have taxpayer pay for abortion. We made sure we took that out as well.
Well, I don't understand. You had abortion in a bill about coronavirus?
Yeah, the things you have to watch, especially when it doesn't go through committee, especially when there's a crisis. People will take their philosophical beliefs and try to run that through. We have the Hyde Amendment that we have voted on for decades. I wanted to make sure that provision was in. I wanted to also make sure there's flexibility, especially for those small businesses 50 or under. If this is a hardship to them, that they have the option to get out. And that was one of the last provisions we got into the bill. I want to make sure people have jobs to come back to.
Let me ask you about this article on the Federalist, which is complaining. The title of the article is Why the Pelosi Wuhan Virus Deal is a Near Total GOP Surrender for blue-collar entrepreneurs. And they are zeroing in on what you're talking about in terms of small and mid-sized businesses. And they're saying that we're going to see layoffs once this is over from small and mid-sized businesses. They need anything they can cling to stay afloat and delay further layoffs. There's nothing for them in this apparent deal, nothing for the blue-collar businessman this country's middle class was founded on. Even the $50 billion that the president previously announced for small business are not only good for big businesses who can guarantee it, but it's bad for smaller businesses. You are getting some pushback on this idea that small and mid-sized businesses are having to put out this big cost.
Well, if they read the final version of the bill, they'd see the flexibility that the Secretary has. The Secretary of Treasury will actually advance the money ahead of time so the small business will be able to have the resources if they have somebody on sick leave. Remember, there's a sunset time period. And also remember what we're dealing with here. Just as Dr. Fauci says, we've got to get through that peak. That peak can overtake the medical system. You watch what the World Health Organization has recently said, that Europe is the epicenter. We want to thank this president for the action he took early, stopping the flights from China, also stopping those flights from Europe. It is making America safer. So how do we manage all this going forward? If somebody is sick, we want to make sure they have testing. We want to make sure they're not at work providing and making contamination to other individuals. So we've got to have that sick leave. We know business is being hurt. There's no basketball going on. There's no March Madness. There's no hockey going on. People are quarantining themselves, which what we need to do as we go through this. So we need action, and that's why we gave that flexibility and the advancement of money. Remember, America working together can get through anything that we need. And we showed just that last Friday night that we can, what divides us can come together for the American public. And you watch the action that this president took. Extraordinary, and he's looking further ahead from the oil industry, filling the spur because it's a lower oil price, helping the energy at the same time helping America, making sure no interest rates on those who have student loans. We're taking every possible action, but this is a moment in time that we need to come together, and that's why sunsetting it, giving small businesses the resources they need and help during this time, we will get through this together, and we will actually be stronger in the end.
Yeah, I mean, you make a good point. This is a moment in time that all hands are on deck. This is a moment in time that everyone's worried about this pandemic now, the World Health Organization is calling it. So why did it take so long to get this done? Why were you at work at 1 a.m. on Friday night? I mean, why did Nancy Pelosi have so much delay if this is if there's such urgency?
Well, there's a number of reasons of things going through, but the reason why it was late into the night, I did not want to see a bill jammed because it did not go through committee. I wanted more eyes on it. I wanted the ability to walk through every version. Like it's going to go to the Senate. I was working with Senator McConnell, the leader over in the Senate, on numerous things that I would see that it could enhance even further. Working with this president has taken decisive action early to help us in this cause of where we're walking through. This bill adds to that at the same time. You want to have testing. And I think what the president has done with that public-private partnership, every community either has a CVS, a Walgreens, a Target, or a Walmart, to be able to open up their parking lots to have this testing and have the new version of testing going through. We have innovative companies here that are going to help us. You look at what Gilead is going through with the therapy for the treatment. You look at Johnson & Johnson and other companies to get us a vaccine. We want to work through this together. I remember the story about President Kennedy when he challenged this country to go to the moon. A year later, he's walking through NASA. He's meeting those who work there. He runs into an individual who's a janitor, and he asks him, "What's your job?" And he says, "My job is to put a man on the moon." At this moment in time, Republicans, Democrats, and all Americans need to come together, and our job is to make sure we get through this virus attack that did not come from here, and make sure we're safe, and we're going to take actions we haven't taken before, and we will come out stronger just as we have before.
So when we were on the phone this weekend talking about this interview, you talked about this virus being sort of like an arc. It's going to get worse before it gets better, and then maybe it dies down. But do you expect that it comes back in the fall?
Well, not sure. We learn something more every day about this coronavirus, but affluenza normally in summertime dips down and can come back in the fall. What we need to have happen here is, as many in the NIH will tell you, you do not want to have something to overrun as a big peak. You want to level it out, as the graphs would show. Italy right now did not have that happen because their leadership did not take the actions that President Trump took. That's why the next 4 weeks are so critical. That's why this determination of the actions that we are making are smart in the long run. We do not want our health care system. That's why elective surgeries are being pushed aside. That's why we're preparing and doing a public-private partnership, more testing, the VA. This is more vulnerable for those who are older. All the information that we have, the washing of the hands and the others, everybody needs to be working together, and I think Congress showed that Friday night.
Let me ask you, Congressman, before you go, we're going to talk about the economic impact with Peter Navarro, and a lot of people are expecting recession. I love what the president said the other day about oil and buying new oil. We're going to talk about that with Peter Navarro as well. But from your standpoint, in terms of getting to a vaccine, what you just said in terms of pharmaceutical companies, are you willing to make sure that the rules and regulations around the FDA in terms of getting a drug through approval process are dealt with some leniency in terms of getting a fast-track approval?
Yes, the president has already taken actions on that as well. What's unique to here is we have had some changes within the FDA in this Trump administration to streamline, to make sure nothing from a bureaucratic instance is holding it up. And we've got a lot of smart companies out there already working together. Remember, when Ebola hit, it was an American company that got the vaccine. We were able to use NIH to make sure that containment happened. Unfortunately, when this crisis hit, China hid from it. In November, it came forward. President Trump asked to send our scientists, our doctors, our very best researchers there. They were not allowed to. Now it is spread across the world. But the actions that President Trump has taken has actually made us safer.
Yep.
But unfortunately, now Europe is the epicenter.
Yeah.
And that's why the action that he took on the flights coming through. That's why Americans need to work together, but it has to be a public-private partnership. And I will tell you, we have overcome things that are bigger, but the next 4 weeks are where we need to be smart, act together, and find a way that we will get through, that we will not have that peak, but we will measure this out. At the end of the day, you and I will talk again on this show, and we'll talk about the ingenuity of our companies that got a vaccine for it and how we were prepared ahead of time, just like we did by increasing funding to the NIH and CDC for the last 4 years.
Do you think that you're going to need to, the president will need to mobilize the military to create hospital beds? I know we've got a lot of shortages, including hospital beds, as these numbers spike. Are you going to need to, is the president going to need to mobilize the military for this?
Well, the one thing that we could do, there is a bill by Dr. Burgess that you bring in the reserve medical in to help in that instance. You want to make sure you protect. The other element inside this bill I did not talk about, we want to make sure that we have more masks, especially for all those in the medical industry,
is doing that,
so
right?
they are protected. Yeah, but this bill allowed them to actually produce millions of more, the industrial level version that can help those in the medical industry, and now they can sell them to them. So there's many different elements of this bill that protects us even further.
All right,
and these are the plannings that we are taking. Unfortunately, we tried to get that in supplemental, but Democrats had said no earlier.
Congressman, it's good to have you on the program this morning. Thanks very much for your efforts.
Thank you, Maria.
We will see you soon. Minority Leader Kevin McCarthy there.